from 21st Oncology. I'm so happy to welcome back to the show this morning Dr. Mark Bloomston. Good morning.
Good morning. Thank you.
Glad to have you back. I learned a lot from you the last time you were here. This morning we're going to talk about liver tumors, which is interesting because I automatically assume, okay, we're going to talk about liver cancer, but you're saying not all liver tumors are cancer.
That's true. There are benign tumors that can either become cancerous or can cause pain, can cause various symptoms that we don't necessarily have to treat but need to monitor to look for changes and see if they do become worrisome.
Is it pretty common? Is this something that you see a lot of?
Well, we see a lot of cysts and things that probably are never going to become problematic but certainly cause a lot of angst in someone's life. And because scans are done for so many reasons, we pick up little things in the liver all the time. So I see a lot of patients where I'm often just having to calm them and reassure them that it's okay, but there are some things that warrant some attention.
All right. Well, we're going to start from the beginning. You gave me a little anatomy lesson in the commercial break. Do you know how big the liver is? I was thinking it was kind of the size of your hand. That's kind of what you said. Most people think that. I'm not alone, right?
That's true.
The liver, it's a big organ.
It is a big organ. It's probably about this big. So it fills the whole space in the right upper quadrant behind the ribs. And a lot of people forget about their front to back dimension, but all that is full of liver.
Wow.
Yeah.
So when it comes to our liver, I've heard of people, if it is cancer, let's talk about it, if there is how common is liver cancer, and as far as when you find it and catch it? Well,
true liver cancer, which is a cancer that started within the liver, those are fairly uncommon. You're talking probably anywhere from 25 to 30,000 a year in America.
Okay.
But the most common cancer in the liver has come from somewhere else. So colon cancer, breast cancer, various gastrointestinal cancers will find their way to the liver.
Is it pretty easy to find its way to? Is that pretty common?
Is
that one of the
common.
First organs to be hit after you've been diagnosed with cancer or there's cancer in the body?
That is true, and particularly for gastrointestinal cancers. And half of all patients with colon cancer diagnosed, which is 150,000 people a year, half of those patients will develop a liver metastasis or spread to the liver at some point in their lifetime.
All right, doctor, so let's talk about treatments. Has there been any advancements over the years when it comes to treating, tumors and cancer of the liver?
Well, still, this day and age, that surgery for the liver and removing tumors is the best thing. And you can still actually offer some cures to patients, even though the cancer has spread to the liver. In the last decade or two, we've seen great advancements in the technology, the knowledge of the internal anatomy of the liver, which is very important to have safe operations. You can remove 80% of the human liver safely, and it will actually grow back.
It will grow back?
It can grow back to normal size and function to have a normal life, and to the point that we can often even reoperate on somebody and remove more liver in the future if the liver were to come back, or the tumor come back.
I've heard with the liver, though, that you can't necessarily, if it's losing function, it's not like you can repair it and make it work better.
True. Now, if there's something that's causing an injury, such as a hepatitis virus, such as alcoholism, or whatever it is that causes cirrhosis, that process can't necessarily be reversed, but it can be stopped. The actual regeneration or regrowth process after surgery or injury, however, brings normal, healthy liver back.
All right. We have a little less than a minute left. What do you think, what should people know when it comes to their liver? And certainly we always talk about, looking for signs and symptoms. We want to make sure that we catch things early, that we're on top of things. What's the take home? What do you want people to know this morning?
Well, the greatest risk factors for primary liver cancer have to do with abuse of the liver. Now, that may not be intentional, but it's things like alcohol, hepatitis virus. Hepatitis C is a very treatable disease now, and so to seek attention for those things that may impact the liver. When it comes to tumors that spread to the liver, proper surveillance, maintaining good health care, good liver health, and then not necessarily giving up just because it's reached the liver, because liver surgery is now safe and can affect cures.
Well, I was going to ask, too, as we close, what is the hope? I like to hear some good news from you about the future of maybe treating this as well. Do you think it's just going to get better, and are we, as far as the advancements in technology, are you hopeful?
Absolutely, I'm hopeful. We're seeing chemotherapy make this more of a chronic disease in the case of colorectal cancer, converting patients who have inoperable tumors to operable tumors, and so I'm very hopeful that we can do more.
Good, good, good. Well, as we close, if someone wants to find out more about what we talked about this morning, is there a website you want to send them to, or call the office? Is that maybe the best thing to do?
Yeah, reaching members of the team at 21st Century Oncology, as well as other cancer cancer specialists in the area. We're all forming one big team to really combat these diseases.
Yeah, well, we appreciate you being here this morning again.
Thank
We
you.
always learn so much from you, Doctor.